Hello, welcome everyone to this Dynamics Facing the Future Self-Care Market FIP webinar. We will be talking today about shaping the future of self-care through pharmacy, and I warmly greet you to this event. We have a series of expert panelists who will be talking to us about several topics, and it is my great pleasure to be your moderator for the session today. So my name is Emma Paulino. I'm FIP Professional Secretary, so a member of the Executive Committee and Bureau of the International Pharmaceutical Federation. I am former Secretary of the FIP Community Pharmacy Section. I am a community pharmacist myself, so actually these topics are very relevant for my day-to-day practice. I am president of the Portuguese National Pharmacy Association and also Pharmaceutical Care Network Europe. So it is my great pleasure to be talking to you today and to be able to present to you not only the panelists, but also and starting with some information for all of you who are attending this webinar. So this webinar is being recorded and also live streamed via YouTube. The recording will be made available on our website. So if you have not been able to see the webinar live today, you will be able to access the recording afterwards, and please forward the link to your colleagues if you think that this is relevant to them. You may ask questions using the question box provided. So we invite you to, for instance, use the chat box to introduce yourself, greet your colleagues. But if you would like to place any questions to the panelists today, we would like you to use the Q&A function, which you will find on your Zoom application. You are also welcome to provide feedback, and you can use this email, webinars@fip.org. So your feedback is very important to us because as we have been organizing a series of webinars and live events, and we aim to continue to do so. Your feedback will obviously be important for us to improve our digital events footprint. We also warmly invite you to become a member of the International Pharmaceutical Federation so that you can have access to this information, but also a lot of other interesting features and the opportunity to network with your colleagues around the world. And you can do so using the link that you can find on the website. And you can also obviously look for more information about membership benefits on our website, www.fip.org. I would also like to thank Reckitt for supporting this online program. Thank you very much. It is due to this sponsorship by Reckitt that we are able to have this series of webinars on self-care. So thank you very much for the opportunity to present these contacts to our colleagues around the world. So as for today's program, this is a short welcome by your moderator. Then we will have a few presentations from expert colleagues from the UK and India. At the end of the session, we will have a panel discussion, and we again invite you to ask questions to our panelists so that we can then have an overall discussion at the end. And then we will have a small summary and close of the session in the end. So our learning objectives for today are to describe the future dynamics of the self-care market, explain the value of self-care. We will also be summarizing the economics of self-care, outline the new customer expectations. So we now talk not only about the needs, but also expectations and preferences of our customers. And we will also summarize the impact of digital technology and artificial intelligence on self-care. So as you can see, a very interesting program to start the discussion on self-care. And without further ado, I would like to introduce you to the first speaker of today. We will have Dr. Austin L. Oster presenting with the first lecture. So let me look for information about Dr. Austin L. Oster to present. Dr. Austin L. Oster is director of the Self-Care Academic Research Unit, SCARU. SCARU's mission is to make the absolute case for self-care, and by exploring how the application of self-care could result in improved outcomes and lower dependency on national health systems resources in the contemporary setting, whilst also identifying key evidence-based recommendations for the consideration of commissioners of health and policymakers. Austin is also general manager of the Directorate of Public Health in Primary Care at Imperial College Healthcare NHS Trust, and is supporting the WHO Collaborating Center for Public Health Education and Training in the same capacity. He is director and trustee of the International Self-Care Foundation and author of the Selfcare Matrix, a unifying framework for self-care, which offers a new point of departure for self-care thinking. He remains an active member of the WHO Expert Review Group for Selfcare Interventions and a coalition steering committee member of the Selfcare Trailblazers Group. He's currently working with a consortium of international partners and governmental organizations to advance the study and application of policy prescriptions to promote vitality in aging and the adoption of health-seeking lifestyles for the 21st century living. Dr. Austin will make a presentation on how can self-care contribute to universal health coverage, healthcare's and patients' perspectives. Thank you very much for accepting our invitation to present, and it is my absolute pleasure to give you the floor to present on this very important topic. Thank you very much.
Thank you, Emma, for the introduction, and thank you for inviting me to present today. So, as Emma said, the first talk is going to be really about how can self-care contribute to universal health coverage, and we're going to be talking a little bit about the health carers and patients' perspectives. Next slide, please. So universal health coverage, or UHC, is actually has been around for a while, and it's really concerned about creating a healthcare system in which all residents are assured access to essential healthcare, including promotive, preventive, curative, and rehabilitative services. It's actually centered around three main objectives of ensuring equity in access, the provision of quality services, and financial risk protection to ensure that people are not out of pocket when they access needed interventions. It's also appearing in the WHO triple billion target that says by 2025, 1 billion more people will be benefiting from UHC. The other billion people will be better protected from healthcare emergencies, and the other billion is people who will be enjoying better health and well-being overall. Next slide, please. The WHO already uses 16 essential health services in 4 categories as indicators of the level and equity of coverage in each country. So I've bundled them together here into 4 blocks. The first one, the reproductive, maternal, newborn, and child health, has 4 elements in it. Then we have the NCD, then you have the infectious diseases, and the service capacity and access. I highlighted in green the items that are actually represented in the WHO guideline on self-care interventions. We'll come to these in a minute. The blue items are actually acts of self-care, although they're not in the guideline. You know, immunizations, vaccinations are an act of self-care. Obviously, health-seeking behaviors are self-care, and limiting tobacco use and so on are acts of self-care. The items in black are essential services that hospitals and healthcare systems need to embed to ensure that they could realize the vision of UHC. Next slide, please. So what's interesting, in 2019, the WHO published the first consolidated guideline on self-care interventions for sexual reproductive health and rights. That guideline in 2019 included 24 recommendations, and it was refreshed in June 2021, a few months ago, and was renamed to the WHO guideline on self-care interventions for health and well-being. The guideline has 39 recommendations in total across 6 categories. The first category is about improving antenatal, intrapartum, and postnatal care. It consists of 13 recommendations. The second category is concerned with providing high quality services, family planning, and infertility services. The third category is concerned with eliminating unsafe abortion. The fourth is looking at combating STIs, including cervical cancer and other gynecological morbidities. The fifth category is about promoting sexual health. And the sixth is looking to address NCDs, including cardiovascular disease and diabetes. So the items are highlighted in red. These categories are actually quite relevant to the universal health coverage vision, and we'll discuss how in a minute. Next slide, please. The WHO guideline also includes two recommendations that are looking at population-specific implementation considerations. And if you look at the red items here, they're quite relevant to UHC because it's about prioritizing digital health services, self-care interventions, scarce shifting in pharmacies and otherwise, and outreach to community to ensure access to medicines, diagnostics, devices, and so on. And there's also a bit about promoting self-care strategies and looking for person-centered approaches to promote self-care in a way that is tailored to people's needs. Next slide, please. So what is self-care anyway? It's the oldest type of care we know. This has been around for thousands of years. So it's unsurprising that we have so many definitions of it. In 2011, Godfrey published a paper in which he identified 139 definitions in the academic literature. And even the WHO has 5 definitions. Here's one example. Self-care is what people do for themselves to establish and maintain health and to prevent and deal with illness. And like I said, there are 5 definitions with WHO, and as definitions expanded, they became more inclusive of health and well-being. But self-care is commonly used and often synergistically or interchangeably with self-treatment, empowerment, self-efficacy, activation, and self-management. Next slide, please. But rather than just getting lost in definitions, perhaps it's easier to conceptualize self-care instead. So this is the self-care continuum developed by the Selfcare Forum UK. It shows the ideal placement of an individual on the left of the continuum. So people are making daily healthy lifestyle choices and they could do what they want to go about as they please. Next, please. But if we become ill or if we break a leg on a skiing trip, we may need nurse support, we may need some analgesics, and as we recover, we then slide back to the left of the continuum. So this beautifully describes how self-care here could be looked at in the context of resource utilization. So people with long-term conditions are somewhere in the middle. They could still self-manage self-care, but they need some support from pharmacists, from medical doctors, and certainly from medicines. But people on the far right are in trauma, they cannot self-care and are exempted. And I think my colleague Donna is going to be talking more about that later. Next slide, please. Another way to conceptualize self-care is represented here by the 7 pillars of self-care infographic. This infographic really describes the self-care activities that people can do on a daily basis to prevent, delay, or alter the disease course. The first pillar is looking at health literacy and knowledge. The second pillar is about mental well-being. The third is about physical activity. The fourth is concerned with healthy eating. The fifth is concerned with risk avoidance. The sixth pillar is about good hygiene practices. Now, these could be oral food hygiene, even digital hygiene, or limiting blue light before bedtime, and so on. And the seventh pillar, really important, is concerned with the rational use of products and services. Now, these include over-the-counter medicines, prescription-only medicines, and even community assets like parks and green spaces and digital health apps. Next slide, please. So here I've listed some of the key enablers of self-care. We have technologies, digital health, electronic health records, the personal health record agenda we'll come to in a minute. Of course, activation, empowerment, and choice are a key enabler of self-care. We have self-care technologies in the form of over-the-counter products, vitamins, minerals, supplements, and even, like I said, green spaces, parks, and apps. We have social media that people get their information from, gyms and places of health and well-being, health restaurants, nutritionists, and of course, your social network for mental well-being. But crucially here, we have the pharmacy and pharmacists. They are key enablers of self-care. Next, please. And all of this is coming together now with the new emergent specialty of lifestyle medicine. So these are medical doctors who may choose to specialize in lifestyle medicine. So lifestyle medicine is really looking at coaching, behavior change, trying to get people off medication where possible, lifestyle over drugs, basically, especially if it comes to obesity or other lifestyle diseases. A lifestyle medicine doctor may recommend exercise and diet, as opposed to bariatric surgery, for example, for those who would benefit from it. Next slide, please. So we've seen two models of self-care conceptions, the self-care continuum and the 7 pillars. And we put this all together in what we're calling the Selfcare Matrix, which we hope describes the totality of self-care and would very much help pharmacists, governments, and individuals and commissioners of health and well-being see how best they could develop effective self-care interventions. So the Selfcare Matrix says that self-care has 4 dimensions. Next, please. The first dimension is concerned with the 7 pillars of self-care, which you've seen. These are, person-centered activities that people would do, and they operate at the micro person-centered level. It's about empowerment and choice. The next dimension is really concerned about self-care behaviors. It's really about capability, motivation, opportunity. What are we doing to sustain these health behaviors? It's not just having the 1 salad a week. It's trying to eat as healthy as possible throughout the life course, and so on. The third dimension, you've seen this as the self-care continuum, is really concerned about resource utilization. So commissioners of health and well-being are very keen to push people to the left of the continuum. The question is, well, what are they doing in the dimension 2 and 3? Which pillars of self-care are they activating and to what extent? And how are they embedding these self-care behaviors in a way that's sustainable? And the last dimension here, the 4th dimension, is looking at the self-care environment. Now, this is policy, and like I said, community assets and health systems. And the universal health coverage would talk to that dimension, and we'll see how in a minute. Next, please. So interventions can be designed to ideally address all dimensions of self-care, but oftentimes app developers or commissioners of health would look at activating 1 or more pillars. But this gives a bird's eye view of what can be done across the totality of self-care. Next slide, please. So we know from evidence that there's a very strong inverse relationship between self-care and lifestyle diseases. Unhealthy eating, obesity, high-fat diet, smoking, and alcohol, these combined are very likely to lead to preventable lifestyle diseases. The good news is we know very well the personal risk factors and the intermediate risk factors that lead to these diseases like heart disease, stroke, cancer, lung disease, or type 2 diabetes. So by controlling these risk factors of high blood pressure, raised blood glucose, hypercholesteremia, and obesity, we can actually prevent, delay, or alter the disease course. And that is really important. It would help people feel better, live longer, hopefully, and would cost the economy much less. So there's obviously a very big association here between self-care and behavior change, and we'll come to that in the next slide, please. So evidence shows that self-care has huge benefits. We already know that we could practically abolish 93% of new onset diabetes and 80% of heart attacks and half of strokes and a third of cancers through self-care. And that self-care can reduce all-cause mortality, and it can vastly improve the quality of life. So it has a huge social and financial return on investment potential. And this is something that's being looked at very closely now by the American College of Lifestyle Medicine, the European Lifestyle Medicine Organization, and the British Society of Lifestyle Medicine. There's a big movement currently happening, and you would have seen it, that self-care is really, it's being called lifestyle medicine, but that's great because it is a type of medicine. Next slide, please. So the WHO recognizes this, and here is a schema copied from their guideline, shows self-care in the context of interventions linked to health systems and universal health coverage. Now, it may be about self-awareness, self-testing, and self-management, and we can access these interventions in many settings. We could use digital health platforms, traditional medicines, traditional health facilities, GPs, caregivers, family, social network, and of course, in the home and community setting. But a really big part here is pharmacies and the role that pharmacies are and will play in the future to promote access to self-care interventions. Next slide, please. In the UK, Public Health England launched some years ago the Healthy Living Pharmacy. So the idea really of the Healthy Living Pharmacy is a framework which is aimed at achieving the consistent provision of a broad range of health promotion interventions through community pharmacy. And instead of just being a place where people can go and buy stuff, a product, an OTC, they can actually see it as a community hub to promote health and well-being. They may have access to point of care testing and other lifestyle advice. Next slide, please. So the pharmacy landscape is changing. Not only do we have technologies that are OTCs and medicines, but we also now have devices. So with increased use of point of care testing, we may be able to have a one-stop shop, for example, where people can do a health check by looking at their glucose or HbA1c and other lifestyle stuff that we'll then be able to give people their risk score for cardiovascular disease. And for this, I think pharmacists, they increase their skills mix. Many competencies are required to promote, for example, coaching or ensuring that point of care tests are done accurately and so on. And in the home setting, there's a big emphasis now, certainly in the UK, on remote monitoring. So whether it's through blood pressure monitors, glucometers, oximeters, there's a big movement to get these products into people's homes. And they don't have to be patients. They can simply be people who are interested to maintain health and well-being. So for this to happen, of course, we need to onboard these people properly. They need to know how to use these products in a way that's reasonable, responsible, and hopefully it'll get them to adopt these healthy lifestyle behaviors and to adhere to medical regimen where needed. Next slide, please. And we will all know, of course, the digital health agenda and the many, many thousands of wearables that are now being sold and the many, many hundreds of thousands of apps that are available. These are exciting technologies, but they're still largely consumer focused and they're not yet embedded in the fabric of the NHS, in the health system. But this is changing as we develop more agility in the personal health record space and as more integration of data. You know, I think very soon in the next few years, and there are already pilots in the UK and elsewhere, that people may relinquish some of their personal health record data to be appended to the electronic health record for the physicians to see. And therefore they can have a more holistic view of the individual lifestyle and therefore can recommend some interventions that are suitable. Next slide, please. Another way to democratize self-care is really through the use of symptom checkers. And we'll see how that's become relevant to universal health coverage. So symptom checkers are available now. There are many. There's Healthily, there's Ada, there's Babylon, there's WebMD. There are so many other options, and really they can provide end users with a consultation outcome. And some symptom checkers can also tell you if you need to see a GP or maybe seek emergency support or maybe to self-care for a self-limiting condition. The key bit here is that these technologies can actually reduce pressure on scarce healthcare resources, and therefore would make the vision of realizing universal health coverage closer to home. Because obviously universal health coverage is interesting in how it would be funded. It should be free at the point of care, but not all countries have that facility at the moment. Next slide, please. The good news is there's a vast opportunity to self-care. Every year we have so many hours in the year and we usually spend less than an hour with a medical professional. So what are we doing in all the other hours? So new skills are required by us, the people, patients and pharmacists and doctors to promote self-care in any which way, in any setting. Next slide, please. And clearly then it's all about behavior change and to find a way that we embed good health-seeking self-care behaviors from a young age, because once you have a behavior, it's actually quite difficult to change, as personal experience would show. So self-care and behavioral lifestyle modification are a huge area of focus today, as we've seen in the COVID pandemic. We'll come to that, including a lot of emphasis now on what's being done in the workplace. There's also the approach from cradle to grave, or the from 5 to 105, or how we go about our life course. So what interventions can we put in place to ensure the sustainable adoption of good health-seeking behaviors from a young age, in the school setting, and the work setting, and the home setting, and even through retirement? And there are a number of technologies and techniques we can use. We could look at activation, improving patient activation measure. We could use gamification, nudge theory, and all sorts of personalization stuff to try and get people to adopt these health-seeking behaviors. Next slide, please. So this is again from the WHO guideline. I found it interesting, so I put it here. There's this triad of the person, the health worker, and the community. So self-care obviously is person-centered, it's about the self, but the health workers and pharmacists and the health ecosystem really, it would be a great enabler of self-care with technology, coaching, advice, and the community as well. So there's a difference between an active self-care and self-care praxis and self-care practice, and when self-care becomes embedded in the fabric of society. So we hope that in the many years to follow, self-care is considered more sexy. It's no longer on the fringes. It's no longer about hot chocolate and yoga only. It's about many of the evidence-based interventions that we know exist. Next slide, please. And of course, these would all promote the universal health coverage agenda, because again, like I said, if we self-care more, we would probably need less precious resources, and therefore we'd be able to release resources for use in UHC. All countries are very keen now to promote prevention, upstream measures of prevention, as opposed to downstream interventions, because it'll be too late then. You know, people in hospitals are expensive and broken. In an ideal world, where possible, we will prevent or delay or alter the disease course, as opposed to having to deal with it much later. So the idea of the prevention agenda is people live longer, healthier lives and cost less money. The big question is, what are the best interventions for self-care? We have the WHO guidelines, it's very clear. We have 39 recommendations, but also we look at the pharmacy. This is FIP, so we will focus on that. And the role of pharmacists and pharmacies in scaling up self-care interventions. Next slide, please. Just because we're still in the pandemic, so I thought I'd put this here, and to just highlight that actually it was through self-care that we were able to flatten the curve for COVID. It's through acts of self-care like personal protection equipment, hand sanitizer, risk avoidance, good hygiene practices, and so on, and even using the contact tracing app. Here's digital technologies. It's through self-care that we were able to flatten the curve. And next slide, please. And we could use the same logic to say, well, if we want to have universal health coverage, then it's important for people to self-care more properly, because then you will release these resources that otherwise would be used, and therefore you will have a more sustainable healthcare system, and therefore more able to deliver a high quality UHC agenda. Next slide, please. So we're coming to the end of it now. Just to reiterate, the pharmacy and the self-care journey, I think they've been wedded for many years now, and increasingly so. Pharmacists and healthcare professionals have a key role in scaling up access self-care interventions, products, services, and technologies. But this would require a new set of competencies, including a wider skills mix, for example, using OTC point-of-care testing, maybe coaching, and promotion of remote monitoring to deliver right-in-time interventions to people who need it, nearer to them in the community setting. And behavior lifestyle modification and lifestyle medicine approaches can help patients prevent, delay, or alter disease course. We've known this for many years, but this unpacks a bit about rights and responsibilities. You know, should people be doing more to self-care, without being too hard on this, but, how can we give people back some of that responsibility to help them take more responsibility for their health and well-being? Next slide, please. So in conclusion, self-care is a critical answer to tackling COVID. We've seen this and we're seeing this now, and certainly is the answer to tackling the rising epidemic of preventable lifestyle diseases. There's a growing international movement of self-care at the moment that is quickly picking up momentum, thanks to the WHO guideline and the remote monitoring agenda and the global commitment to deliver UHC. And in conclusion, self-care then is a key driver of UHC because it can reduce demand on already limited healthcare resources, and UHC would otherwise be unsustainable. Thank you very much. Happy to take questions later. Thank you.
Thank you very much, Dr. Austin, for your interesting presentation. And really, it's we can clearly see that besides the existing trend to self-care, this is actually must need change in order to create an environment where we do have sustainable healthcare coverage for all. So I think that this is a very good starting point for the discussion on self-care and how pharmacists can actually be a facilitator for this movement and also support people making choices that increase their quality of life. I'm sure that we will have some questions for you during the panel discussion. I strongly encourage all participants to insert their questions in the Q&A box, and we will get back to you in order to reply to all the questions that we will have at the end. Thank you very much again for your presentation. We will move on to the next speaker, which is Donna Castle. Donna Castle is Executive Director of Policy and Communications at PAGB, the Consumer Healthcare Association, which represents manufacturers of branded over-the-counter medicines, self-care medical devices, and food supplements in the UK. Prior to joining PAGB in January 2015, Donna worked at two national UK healthcare charities, Diabetes UK and the British Lung Foundation, and was head of public affairs and policy at the Chartered Society of Physiotherapy. She has also worked in two full-service communications consultancies. Donna is a healthcare communications expert with a specialism in public affairs and lobbying. She is an elected member of the Council of the Chartered Institute of Public Relations and has been a chartered PR practitioner since November 2015. Donna will be talking to us about innovation in self-care models, shaping the future together. Donna, the floor is yours. Thank you very much again for accepting our invitation.
Thank you very much for your invitation. Very much delighted to be with you today, and happy to hear that there's so many people from all over the world joining us. So it's nice to speak to you all. As you mentioned, Emma, PAGB is the trade association representing the consumer healthcare industry in the UK, and one of our aims is very much to empower self-care. My presentation, therefore, is very UK focused, but I hope that there will be some useful information in there that will be of benefit wherever in the world you are this morning or this afternoon or this evening, depending where you are. So I'm going to share some of our data on people's use of healthcare services and how the pandemic has influenced people's attitudes to self-care in the UK. I'm going to share some self-care examples, some case studies that we've identified that have had a positive impact. And finally, I'm going to talk to you a little bit about our vision for self-care. So if we can move on to the next slide, please. Thank you very much. So Austin has already talked to you about definitions of self-care, so I won't dwell on this, but we believe that self-care comprises the actions that individuals take for themselves on behalf of and with others to develop, protect, maintain, and improve their health and well-being. The benefits of self-care are wide-reaching and interlinked. It allows people to take ownership of their health by recognising the symptoms of minor illnesses and how to act on them to stay well. It has an important role in minimising unnecessary doctor appointments and hospital visits for minor illnesses, freeing up healthcare professional time for those who really need it. Where there are wider social determinants impacting on a person's health, there is a greater need to empower them to look after themselves, as well as understand when to seek advice. And by equipping people with the knowledge to take greater care of themselves, self-care can also play a significant role in driving improvements in population health. If we can go to the next slide, please. You will have seen this before, and if you can just click one more time to get my circle on the screen. Austin has already shared the self-care continuum, which we agree is a very good way to conceptualize self-care. And we believe that self-care covers three main areas, and that's the three areas that we talk about with regards to self-care. So that's healthy living and prevention, the daily choices that people make for themselves and their health. Self-care for self-treatable conditions or minor ailments. And then self-management of long-term conditions before, as Austin described earlier, you move further into hospital care where there's less personal responsibility involved. So moving on to why we need people to self-care. Prior to the COVID-19 pandemic, and these figures are specifically for England, not for the whole of the UK, we identified there were 18 million GP appointments and 3.7 million visits to the accident and emergency department in hospital for minor ailments or self-treatable conditions which people could have managed themselves. This included 20,000 GP appointments for travel sickness, over 1 million appointments for backache, and 5.2 million appointments for blocked noses. I'm sure as pharmacists on the call, you would all be very happy to see people with those conditions in your pharmacy. We estimated that the cost to the National Health Service of these people not practicing self-care was in the region of £1.5 billion a year, which could be reinvested into patient care elsewhere. So this is a significant impact on the universal healthcare system that Austin has been talking about. So if we can move to the next slide, please. I thought it would be interesting to show you the conditions that people say they experience most frequently in the UK, and these are UK figures. The most common conditions are fairly consistent. Allergies were very high last year. It was a very difficult season for those people with hay fever. And we can see colds and coughs coming up this year, as I think perhaps some of the lockdown restrictions have eased and those viruses are starting to circulate in the population again in a way that perhaps they weren't as much last year when the UK was in lockdown for a significant proportion of the year. So on the next slide, looking at the impact of the pandemic, it has been devastating in so many ways, and I don't want to take away from how difficult it has been for so many people. However, our surveys suggest that people's experience during the pandemic may have had a positive impact on their attitudes to self-care. So that may be a silver lining within the big cloud that has been the COVID-19 pandemic. So people have said that the pandemic has changed their attitudes to the way they access healthcare services, but also their attitudes to self-care. And we've seen those figures increase this year from last year as well. Moving on to the next slide, which I think you'll be interested in. This is how people's attitudes to pharmacy have changed over the course of the pandemic. We've seen the number of people visiting pharmacy in the UK increasing significantly. For many people, this was the only part of the healthcare system that was open during national lockdown. So it was the only place people were able to access face-to-face advice. And I think that's had a very positive effect on the way people view pharmacies and pharmacists. So we've seen more people saying that they would go to their pharmacist for that initial advice for a self-treatable condition or minor ailment. And people who wouldn't have ever thought to visit a pharmacy before the pandemic, nearly a third of them now would do so, and that's remained consistent from last year. Some of you may be aware of a new service that we have here in England called the Community Pharmacist Consultation Service. The GP Community Pharmacist Consultation Service started at the end of last year. And this is a service where people who phone the doctor's surgery with a condition that a pharmacist could help them with are referred to a consultation with a local pharmacist, and the pharmacist is reimbursed, is paid for that consultation. It's really positive to see that there seems to be positive support for that service among members of the public, with 69% saying that they think that's a good idea. Equally, it's vital that pharmacists have the tools to support this role in helping people with their self-care and their self-treatable conditions. And so it's great to see that there's strong support for pharmacists being able to view medical records, which at the moment they can do in the UK, and even stronger support for people for pharmacists to be able to update medical records, which is a development that we're hoping to see. So for those people that maybe wouldn't go to a pharmacist instinctively, if we go on to the next slide, we asked what would make people more likely to ask a pharmacist. And overwhelmingly, the most popular response was more privacy in the pharmacy. Now, most pharmacies, I think almost all pharmacies in the UK now do have a private consultation room. So this may be some nervousness around people asking in a busy pharmacy store to go into the consultation room. We can be very shy as British people, and asking to visit the private consultation room could be, you could be suggesting that you have something private that you want to talk about. And some people may feel shy about making that request in a busy pharmacy. Interestingly, telephone access was something people would welcome, less keen on having video call access to a pharmacy. Other things which would be seen as positive for a pharmacy is to be able to refer to other healthcare professionals. So if somebody comes into the pharmacy and their condition is not suitable for self-care, for that pharmacist to be able to make a referral, not necessarily just to a doctor, but perhaps to a physiotherapist or a dentist or an optician or one of our other healthcare colleagues who may be more appropriately suited to help them. And then again, you can see people feeling it would be positive if the pharmacist could update their medical records with the details of the advice that they'd been given. So on the next slide, an example of where we've seen this work well is in local pharmacy first schemes. And we've seen these in a couple of areas of the country where work has been done to encourage people to speak to the pharmacist first when they have a self-treatable condition or minor ailment. And we saw that in Bradford, just in 8 months, so in less than a year, a pilot scheme there released more than 900 hours of doctors' time across 27 doctors' surgeries. And that was mainly in people seeking treatment for coughs, colds, fevers, so those sort of winter viruses that we see every year. And in the Isle of Wight, which is a small community just off the south coast of England, they found that on average 500 people now consult a pharmacist each month rather than booking a GP appointment for those self-treatable conditions. So this is evidence that encouraging people to go to the pharmacy first is positive, has a beneficial effect for other parts of the health service, but actually also people like it and they continue to do so. So moving on to the use of doctors' surgeries and hospital emergency departments. Again, in our survey, we asked people what they would have done before the pandemic and what they're more likely to do now. And among people who would previously have just gone to the hospital emergency department straight away without asking advice anywhere else first, we now have 68% of those people saying that they're less likely to do that because of the experience during the pandemic. Equally, people who said that they would always go to the doctor first, no matter what, 39% now saying they're less likely to just go straight to the doctor than they were before the pandemic. This is very positive and suggests that the number of people willing to self-care, rather than straight away going to check with the doctor or the hospital, is positive. However, you'll see from the comparison with our 2020 survey results that these results are starting to slip back. And our concern is that if we don't take action now to embed some of those positive behaviours and those positive attitude changes that we have seen over the last 18 months people will start to go back to doing exactly what they did before, which, as you will remember, is 18 million appointments at the doctors for self-treatable conditions and 3.7 million visits to the hospital emergency department for the very kinds of conditions that you as pharmacists are really best placed to support them with. So on to a couple of case studies of how different areas have tried to address this. Bromley Bibo Health Partnership was looking particularly at children under the age of 5 and the fact that their parents were frequently asking the doctor for support for minor health conditions. They set up a project which provided learning sessions for parents to help them understand when their child's condition needed a doctor and when they could support it effectively at home and perhaps with the advice from a pharmacist. When they evaluated the project, they saw that there had been a significant increase in knowledge, confidence, and skills among parents, and that resulted in a reduction in the number of GP appointments for those parents that had attended the health sessions. The next case study, also looking at children, on the next slide, please, is in Cheshire. Thank you very much. And this was children being taken to the hospital emergency department. And the numbers in that particular area were significantly above the national average. So they wanted to look at how they could support those parents to care for their children more effectively. They set up an app to provide health advice, information, and support groups to help those parents understand whether they really needed to rush their children into hospital. As a result, they found that 47% of app users said they had chosen self-care, and over a third said they felt more confident in practicing self-care for their child. And then to show that this also has a positive impact on the use of services, 22% fewer children discharged from hospital with self-care advice. So that shows that it was beneficial for the parents, the children, and the health system as a whole. So moving on to the next slide, what we have seen is that enabling people to self-care, when it's appropriate to do so, is vital to support the sustainability of healthcare systems. We've also seen that people are willing to self-care and that pharmacy has a central role in supporting that. Our vision for self-care at PAGB is one where individuals do understand and are willing to practice self-care where it's appropriate for them to do so. That the culture of healthcare professionals shifts towards encouraging and supporting that self-care behaviour. That the system is designed to support self-care, and self-care and access to pharmacy are fully integrated into the primary care pathway before an automatic visit to the GP or to the emergency department. And that we use digital technology to its fullest potential to support this change. And we've all seen the acceleration in the use of digital technology over the last 18 months. And we think there are a lot of benefits that we can take from that and learn going forward. So on to my final slide, which is that PAGB is calling for a national strategy for self-care. And the idea of this is to provide leadership and coordination to ensure that policies are put in place consistently to support self-care. I've given you some examples of local areas where local initiatives have been developed and have been very successful at supporting and empowering people to self-care. But at the moment, there's no consistency in that across the country. And we feel that taking a national approach to ensuring that there are appropriate systems in place would be much more effective in embedding that systematic self-care behaviour that we want to see following the pandemic. So on the slide are some of the things that we would like to see within that strategy. So addressing inequalities in health literacy, And that would include educating children at school so that the next generation become adults fully equipped to self-care and understand how to use healthcare services, but also to support healthcare professionals in their professional development, helping them have the tools to support people to self-care. We want to enhance the role of pharmacy even further, making best use of the community pharmacist consultation service that I mentioned, enabling pharmacists to refer on to other healthcare professionals where they aren't able to help the person in front of them, ensuring that they have appropriate access to medical records, both to be able to read them and to record into them. We want to improve access to effective over-the-counter treatments, again, giving pharmacists more options to provide to their patients and local community. To build on those developments during COVID-19 of technology, and we use technology particularly well in the NHS to support people to understand the symptoms of COVID-19. We think we could do that with other self-treatable conditions. And to ensure better support for local networks of healthcare professionals here in England, they're called primary care networks, to enable them to deliver self-care at the local level. So we have developed a blueprint document of explaining how we think a national strategy for self-care would work and what that should look like. And we're planning to launch that next month. And then that will begin a campaign to see if we can encourage the health service to adopt this approach in England. I hope that's been interesting and useful. I hope I haven't spoken too quickly for you all. It's something that I do have a tendency to do, so apologies if I did speed up at any point. Please, as I say, do get in touch with me if there's anything that you'd like to follow up on, and I look forward to the panel discussion later. Thank you.
Thank you very much, Donna, and I think that your speech was perfect. Very clear and with very simple and important messages. And I think that it is a very positive view to look at what we can learn from all this context and what also may help us in redirecting how we reorganize and how we deal with conditions that are able to be controlled with self-care and with the support of the pharmacist. So I think that this is a very positive message and a very constructive message in terms of how we can together as a society in empowering patients, how we can have more efficient healthcare systems and improve patients' quality of life. So thank you very much. And I think that we will have some questions for you during the panel discussion. But I would now like to introduce our third and final speaker, because before we move to the panel discussion, and we have Donna Castle, and thank you very much again for accepting our invitation, first and foremost. So Donna Castle is a pharmaceutical doctor who works as a drug safety associate at the Contract Research Organization in India. She is a member of the FIP Health and Medicine's Information Section and is currently serving as the secretary of the section. She has presented in many conferences and has published several research articles in different scientific journals. And she will be talking to us about the impact of digital technology on self-care and artificial intelligence as well in self-care. So thank you very much again, Donna, and the floor is yours.
Hi, everyone. Thank you, Emma, for your wonderful introduction. I'll be talking about the different digital technology and artificial intelligence and the impact of this technology on self-care. Can you go to the next slide, please? So I'd like to begin with digital health and digital technologies which are used in healthcare. And these aspects are interrelated. Digital health basically means different types of digital technology which can be used to enhance an individual's health and well-being. It includes different areas such as mHealth, wearables, telehealth or remote monitoring, etc. And even in clinical trials, different types of digital technologies are used. and as well as in health analytics and visualization, where different types of softwares and tools are used for the analysis of healthcare data for better outcome. Can you go to the next slide, please? So this is again further application of different types of this digital technology in healthcare, such as interpretation of different health data and remote monitoring of the patients, and use of different types of wearables as well. Next slide, please. And several studies have shown that digital health has the potential to support personalization and monitoring, and thus lead to better adherence. In a study, it was found that patients with type 2 diabetes were able to stop taking their medication metformin after 4 months of using self-care apps that encouraged health eating, exercise, and disease management. And during the pandemic, several countries turned towards digital technologies for providing self-care messages and reliable COVID-19 information. Next slide, please. So there are different benefits of digitally enhanced self-care, and these benefits include increased access to health information and services, and it offers a more personalized approach. It gives people informed choice and control of their health and care. And there is safeguarded anonymity and increasing autonomy as well when there is the use of digital health. And digital health also helps in the remote monitoring of health information and health problems, like in places where they have problem with access to the health service and health centers, they can consult the doctors and pharmacists via the remote monitoring system. Next slide, please. Even the World Health Organization has identified the potential for digital health information and interventions to improve health literacy, promote positive health behavior change, and support disease self-management. Evidence-based digital health interventions and resources that aim to support chronic disease self-management or self-care behaviors related to common risk factors for chronic disease have improved dietary patterns, weight loss outcomes, glycemic control, physical activity measures, and rates of successful smoking cessation. And during the pandemic, telehealth services offer increased flexibility for consumers and enhanced efficiencies for providers, and the uptake by providers and consumers during the pandemic illustrates a willingness to embrace alternative modes for health interventions. Next slide, please. And different initiatives have been taken by the government level as well. For example, in the UK, the Organization for the Review of Care and Health Applications provides a health app library and collaborates with national health bodies and governments for evaluation of health apps. It aims to reactivate both the consumers and health professionals to search, find, and be able to provide, use, or prescribe the health apps. And in New Zealand, Health Navigator is a similar health government endorsed app library. And in India, Arogya Setu is a mobile application which was developed by National Informatics Center to spread awareness of COVID-19 and to connect essential COVID-19 related health services to the people of India. And in Australia, Health Star Rating Front of Pack labeling system is an example of a quality assurance framework for products that encourages and supports informed choices. Next slide, please. And this is again application of digital health and digital technology by patients for their health and well-being, as well as for the self-care. And next slide, please. So here, this is about the artificial intelligence. Artificial intelligence is a broad area and it's still an evolving area, and different types of digital health applications, they use a concept of artificial intelligence. So to define artificial intelligence, we can say it is the theory and development of computer systems able to perform tasks that normally require human intelligence, such as visual perception, speech recognition, decision making, and translation between languages. In healthcare, those tasks can range from simple to complex and include everything from answering the phone to medical record review, population health trending and analytics, therapeutic drug and device design, reading radiology images, making clinical diagnosis and treatment plans, and even talking with patients. And the complexity and rise of data in healthcare means that artificial intelligence will increasingly be applied within the field. And key categories of applications involve diagnosis and treatment recommendations, patient engagement and adherence, and administrative activities. And several studies have shown that the application of computer-assisted or AI medical techniques could improve healthcare outcomes in rural areas of developing countries. Next slide, please. So this is again the AI application. Next one. So there are still challenges in the area of digital health, like the proliferation of technology and access to online information have dramatically increased the spread of misinformation about health and healthcare. And the development of a quality assurance framework to assess the credibility and quality of mobile health apps and web-based resources would enable health professionals and other care workers and consumers to access trusted and appropriate health information. And there is a vast volume of available apps and online health focused resources, which is a barrier to effective uptake by both consumers and health professionals of evidence-based digital health interventions. And there are many applications in the health and fitness and medical categories in app stores and in an endless supply of online health advice, but the development and content of these apps and resources are unregulated and largely unevaluated. So critical thinking and appraisal skills are now considered essential to enable health consumers to effectively search for and utilize appropriate and evidence-based online health information. Next slide, please. And digital resources are also of little use to people and organizations that lack access to them. Like in rural and impoverished areas where internet and broadband service may be limited, it is essential to address barriers to digital health information and tools with improved technology access, as well as by tailoring design and services to reach those who will most benefit, such as older individuals who may not be equipped to navigate complicated technology. And given the potential barriers and benefits to digital health in medications management, a fine balance needs to be established between evidence-based integration of technologies and constructive experimentation that could lead to a game-changing breakthrough. A concerted transdisciplinary approach adapted to different contexts, including low and middle income countries, is required to realize the benefits of digital health at scale. Next slide, please. So this is a survey which we conducted last year among pharmacy practitioners, pharmacy students, and even pharmacy faculty. And in this survey, we came to realize that even pharmacists do not have complete understanding of the digital technology and digital health, and it is still a new area for them, and they need more trainings and education on the digital health area. Next slide, please. So steps ahead for pharmacists in the digital revolution. So when we conducted this survey, we realized that digital health is rapidly being used in the patient's care. So it should be well understood by pharmacists, particularly its higher purpose of providing good health and well-being. And pharmacists can be benefited from potentials offered by digital health and can become designers of it. And pharmacists should embrace digital health, provide digital health services and products, and be able to compete in the digital landscape like the rest of healthcare is migrating towards. And this is even more accelerated due to the pandemic. So it has become very essential for pharmacists to be trained on the digital health and embrace it. So that's all from my side. Thank you.
Thank you very much, Vidata, for a very interesting presentation. And again, it's so good to see that there are so many advances, particularly in technology, that can also support patients in this self-care movement and increase communication amongst healthcare professionals and the patient as well. So thank you very much again for your wonderful presentations. And we now have around 20 minutes for a panel discussion. So again, for all the participants, and we have over 200 participants from all around the world. So thank you very much for attending. And again, you can use the Q&A box for your questions, or you can also place your question in the chat box. So we do already have some questions, and I will direct them to the appropriate panelist for the reply. But if any of the other panelists would like to contribute to the answer, of course, you can also do so. So there is a question from Professor Donna Castle, and the question is whether we suggest self-medication or self-care under supervision of qualified registered pharmacists. So I think that what this means is where is self-care something that is patient only, or is it considering the support of healthcare professionals and specifically pharmacists? Maybe Dr. Austin, you can comment on this question.
Thank you, Emma, and thank you for an interesting question. Absolutely, I think maybe Donna and Bata would agree with me. I think self-care is obviously an act of self. People should self-care where they can, and to use products and services and technology, including over-the-counter medicines. Now, in reality, when something is over-the-counter, it becomes very accessible. And if people know how to, like aspirins and otherwise, I think people would be rational in how they approach. Increasingly, for example, emergency contraception, ovulation predictor kits, so many other things are now available. Even so the short answer here is yes. People should be empowered through health literacy and other interventions to seek access of self-care technologies, including medicines. There is a role for pharmacists with increased prescribing rights, for example, to know, for example, using point-of-care testing, to know when they can prescribe antibiotics to patients who need them without having to see a GP. I might have missed the question here, but that's my view on this. Absolutely, it's important to give more power to individuals to be able to self-care using technologies and products where possible. Thank you.
Thank you. Donna, maybe you would like to add on this issue, because it is so important. And as you've mentioned in your presentation, you mostly focused on your own experience in the UK example, but there is a very different scope of practice also for pharmacists around the world. So it really depends on whether medication is available for the patient to select on, or whether in some countries we still have the situation where patients cannot access the medication themselves, but they always have to interact with a healthcare professional. That is the case in Portugal, for instance. How do you think that pharmacists should adapt and what pharmacists can do depending on the different scope of practice that they have and the different regulatory systems that exist around the world?
Yeah, absolutely. You're absolutely right. And in the UK, we have two classifications of over-the-counter medicines. So we have general sales list medicines, which can be purchased in retail outlets, supermarkets, petrol stations, And then we have a second classification of pharmacy-only medicines, which can only be purchased under the supervision of a qualified pharmacist. So I think what we would say as PAGB is that we want to encourage and empower people to be able to self-care, with the pharmacist as the first point of advice if they need help and support with their symptoms or with their medications. So as Austin was alluding, for a condition that you experience regularly and frequently, I'm afraid I suffer from hay fever. I might have to put a tissue to my nose in a moment. I don't need to speak to a pharmacist to understand how to use my over-the-counter hay fever treatments, because I've been using them for more years than I would care to admit on this webinar. However, if I wanted to seek treatment or advice on a condition that I hadn't ever experienced before, that's where I think pharmacists can make a real difference, because that's where you can demonstrate your clinical expertise, your understanding of healthcare conditions, and your expertise in medicines and treatments to manage those conditions. So I think certainly from a UK perspective, where we have that ability to buy medicines outside of the pharmacy, ensuring that people receive a very good service when they're in the pharmacy is incredibly important, because that will encourage people to come back. I think equally some of those other things I talked about the pharmacist being able to refer on to another healthcare professional where that's appropriate, the pharmacist being able to record information in medical records is very important, because they can't do that in a supermarket. And those kind of things will actually give people the confidence to go to the pharmacy, but also make people want to go to the pharmacy, because they will get that very positive experience. In other countries, as you say, where it's only possible to buy medicines in the pharmacy, obviously people are perhaps coming into the pharmacy more often, but again, giving that service, demonstrating your understanding of people's health and well-being, I think is a fantastic opportunity to really help people see their pharmacist as a very important part of their healthcare professional team.
Thank you very much, Donna. Very interesting insights. May I go back to Austin before I then have a question to Bidata? But Austin, you mentioned antimicrobials, and there is a question from Raquel from the Philippines saying that pharmacists are usually visited to buy OTC medication, but there are also people seeking antibiotics since instead of paying physicians' professional fee, they want to redirect their money to buy the medicines themselves. So it's also a question of economics for the patients. So the problem then lies on antimicrobial stewardship. Would you like to comment on the scope of practice and how important it is to ensure that there are referral systems, that patients are treated in the right level of care according to the expertise of the different professionals?
Thank you, Emma, for the opportunity to comment. I'm not a specialist in this field, but absolutely, I think antimicrobial stewardship is very important. There's a big international movement using a point of care testing, CRP, for example, C-reactive and otherwise, as a decision support tool to help pharmacists to determine if the infection is bacterial, is really helpful to guide the intervention. However, different countries will have a different perspective. So depending on the policy prescription and the framework in the country, some countries are quite relaxed about it. LMICs, low middle income countries may, for example, for good reason, make antibiotics more accessible in rural settings, because obviously it may be difficult to go to a health facility. So, and that's where the competence of pharmacists and use of point of care would be helpful. Although even with point of care testing, it is virtually impossible to be very, very determined and very sure that this antibiotic is needed. It also begs the question about the general practitioner or the role of the doctor. How would a doctor be different? Obviously they're very smart people and they're medical and they have a license, but they could also, their judgment is also maybe imperfect. So I think antimicrobial stewardship is very important. The out-of-pocket expenses that you're referring to, I think, are a big issue in some countries. In the UK, for example, we have the NHS and people may be exempted, although it's actually quite difficult to access antibiotics without, somebody may have a tonsillitis and they may have a week or two of being ill before they can actually access the antibiotic, by which time they'd be out of the, out of the thick of it. So I think there's an international movement here. It really depends on the framework within the country. Maybe Donna or Radha can actually give more insight into this, but it is a big problem. Until new technologies and decision support rules are developed and people are empowered to learn more about the difference, should I wait it out? Am I getting a fever? Is there an indication that it is a bacterial infection? Like I said in the previous meeting, there are some countries where you can just walk into a pharmacy and buy the antibiotic. It's not about just the financing of it, because antibiotics could be cheap in some countries. It's more about making sure they're used properly. I think I might have evaded the question of funding and reimbursement, but this is something that has to be discussed at the national level. And the policymakers in that country would, of course, know. They'd be well informed. And they'd have to think about the reimbursement and funding within the context of the health system. Hope that was helpful.
Yes, thank you very much for answering that question. And it's absolutely there are significant differences around the world, and we have to take into account cultural, organizational differences, and with that ensuring that patients have the best care that they can have.
If I can add, I think something else on this point is the importance of health literacy and people understanding minor health conditions. PGB did some survey work. It's quite old now, 5 or 6 years old, but we asked people if they thought you should go to the doctor with a cold, and in the UK you can only get antibiotics on prescription. They have to be prescribed to you, so the main source of that is the general practitioner, and 92% of people said no, you should look after yourselves. And then we asked them what they would do personally the next time they had a cold, and 36% of them said they would go straight to the doctor for antibiotics. Now, I think one of the challenges is that people don't necessarily understand that a cold can make you feel really very ill for sometimes 10 days. And I think what we've seen in the UK is that people will practice self-care for 3 days and they don't feel better. Now, obviously, they won't feel better because a cold takes longer than 3 days to clear. But what happens is they self-care for 3 days, they don't feel better. They then look for a doctor's appointment, which takes another few days. And they're maybe going to see the doctor on day 6 or 7 or 8 of their cold, when they still feel quite ill. They persuade the doctor to give them antibiotics, which they start taking on day 8 of their cold. And within 2 days, they feel better. And that reinforces that the antibiotics were the thing that made them feel better, when in reality, they would have felt better by day 10 anyway. So I think antimicrobial stewardship is a big concern globally. And I appreciate that in the UK, it's not necessarily the primary role of the pharmacist, because the pharmacist is not the gatekeeper of those antibiotics. That's more the doctor in the UK. But in countries where the pharmacists have a role in that, I think there's an important educational message to people about what symptoms they're experiencing, how long they should expect to feel ill. And that's not something people want to hear necessarily. They don't want to hear that it's going to be 2 weeks before they feel better, but they need to understand the normal duration of these conditions so that they don't try to buy or get a prescription for antibiotics when they don't need it.
Yes, absolutely, Donna. It's managing expectations as well, and this is why there are so many initiatives that are important, like Antibiotic Awareness Week and other types of campaigns that can really educate the population in order to ensure that we are all managing expectations as best as we can, and making sure that we use the right resources for the right reasons and for to achieve better care and prevent misuse of medicines and resources in general. So absolutely, that is quite important. Maybe I can go back to now to Bidata. We have a question on blockchain. I don't know if you would like to comment on this specific question we get from Sergio Durão. Are you seeing the use of blockchain technology, for example, to create transparency and trust when communicating electronic health records to third parties? So questions on data protection and how do we use this kind of technology? Would you like to comment on that?
So the question is related to the blockchain technology.
Yes, when communicating and sharing electronic health records.
Okay, I'm not familiar with the use of blockchain technology. Actually, this is quite new for me. I'm not sure about blockchain technology. Sorry.
Well, maybe Austin, who just raised his hand, can comment on this.
Yeah, thanks, Emma. My knowledge is limited, but obviously, so blockchain is an incorruptible way to apparently to transfer energy in a way that's secure. So there are great applications in health. So obviously, there is concern with the electronic health record, how that is. In the UK, for example, we've got a special system called the N3 network, which connects every physical hospital together and every GP practice. And all communications go through that. They're very super secure, nearly military grade. But globally, how would you transfer information that's very personal about health to elsewhere for actuarial and other reasons? And blockchain could be used and is currently being used. When it comes to AI and certainly medical devices in the UK, there's a new regulatory framework being developed because it's AI. So to how can you trust an AI, and to what extent can you trust an AI and blockchain? What if something goes wrong? What if, pretty much like driverless cars, the problem wasn't technology and getting the car to drive itself. It was more about the legal framework. What happens if a driverless car has an accident? Which insurance company would pay? So the MHRA in the UK is looking at a regulatory framework to allow more development of digital technologies for the effective use and transfer of personal health records, and for devices or apps that can be classed as medical devices. I hope that was a very brief overview of my limited knowledge of this.
Thank you very much, Austin. I will now go back to Bidata because we have a very interesting comment from Raquel. We were mentioning technology as a means to empower patients, and also how the increased use of resources and wearables, etc., can also provide further information to make better decisions. Raquel is saying that in contrary of what is happening in the Philippines, since we are in a lockdown, the younger and seniors are not allowed to go out and walk, which decreases physical activities and increases the use of technology and social media. But this has an effect in terms of how people sit often in front of computers. They are sitting down. So Raquel asks, how can we help these people?
I think we should practice self-discipline. Like even when we are working from home, we have a tendency to sit in our chair for a long period of time. But we should practice like small breaks in between, or have some meditation apps in our phone, or some small walks around during our working hours, or even if we are a student or something, we should take small breaks in between where we can find a time to take a walk, or just move up in the stairs. We can take the steps and just be home and practice some physical activity. So I think we can take small breaks in between, even if we are using technology for a longer time. We can practice self-discipline, and we can use some applications on our phone, which will allow us to take small breaks in between of our long working hours.
Thank you, Bidata. Those are very good suggestions to keep us moving, even in this era where when we are all mostly sitting in front of our computer, which is what we are doing now also. But hopefully after the webinar ends, I would invite everyone to stretch out a little bit and go for a walk and possibly apply Bidata's suggestions to maintain a good physical activity. Thank you very much for your suggestions. There is a question from Irina on resources, so textbooks for pharmacists in the area of minor ailments, something that some resources that would be available online. I don't know if any of you have any suggestions, but I would encourage you to insert them in the chat box if you have the opportunity. Because of course, sharing good resources for to support pharmacists in this self-care endeavor is very important. In any case, I would like to reinforce that this program is the starting point for a series on webinars on self-care. So it is composed of 8 episodes, and these focus on accelerating universal health coverage for all by enabling self-care through community pharmacy. So we will have a few more episodes that focus on in different areas. Tomorrow we will start with headaches, so you are all invited to attend. And you are welcome to look at our program for the next few weeks to know how you can help patients with these minor ailments in the community. So if you would like, you can scan this barcode, and you can also learn more about supporting self-care in women's health. So we will have this webinar on the 9th of September. And we will have, like I've mentioned, a few other webinars on minor ailments and how pharmacists can support patients in increasing self-care. And I would like to highlight, only after thanking our panelists of today, I think we are moving in a very accelerated manner to the end of our session, so we don't have more time for further questions. So thank you very much for participating. But I think that we can conclude by using one sentence that was included in the chat box by Trevor Gore. He says, self-care does not and should not mean no care. So I think that this is a very good summary of our discussion today. So self-care is obviously a way in which we can increase the efficiency of our healthcare systems and ensure that people do have care and that they have access to care in the level that they need in order to achieve best outcomes. By all means, it does not mean no care, and we, as healthcare professionals, we must assume our responsibility to ensure that people do have the access to the care they need. So thank you very much for that wonderful sentence, so that we can use it as a summary of our session today. Again, I would like to thank Austin, Donna, and Bidata for their participation. Thank you very much. I would like to remind you that we are fast approaching also the World Pharmacists Day. So if you would like to be included in the campaign, thank you very much, Chris, for the slide. Please just go to our website and you can use our templates and with your picture to be included in this movement to increase awareness of the importance of pharmacists within healthcare systems and support our campaign. So you are very welcome to do that. And finally, thank you for your attendance. Again, thank you to Reckitt, and we strongly encourage you to go to our website and look at future FIP digital events, and particularly in this series of episodes on shaping the future of self-care through pharmacy. Thank you very much again
Thank you,
for
Emma.
attending.
Bye-bye.
Thank you.